Welcome to People for Public Services. My name is Shada Lovingia, and I'll be chairing today's forum. And I've done a lot of community work. And also with me will be co-chair for today is going to be Simon for People for Public Services. Today's agenda. If you want to put that on, Simon?
Yeah. Is it not come up? It should. It's
No.
up on my screen, Shada.
It's not here.
Okay.
Yeah.
Just go back. And now, is it there now?
Yes. Thank you, Simon.
Yeah. No, that's all right.
Today's agenda is going to be who are people for public services, code of conduct, how today meeting will work, sexual reproductive health strategy 2023 to 2030, and it will be presentation by our lovely Antonietta Viola, Senior Public Health Officer from Birmingham City Council. This is just some of the members of the People for Public Service, which works to empower you. People for Public Service was created as a partnership between citizens of Birmingham, the Citizen Involvement Team, the leadership of Birmingham City Council, adult social worker, cabinet members, so that citizens could have a voice in how services are designed and delivered. We are always looking for new people to join us. I will give you an email at the end of the presentation to contact the team. Next slide, Simon. So this is our code of conduct for today. All comments or questions must go through the chair. Act inclusively, respect each other, and also we are all adults, so treat everyone equally. Check everyone understands what we speak and not to use jargon language. Next slide, Simon.
I've just put it up, Shada. It might be just slightly slow coming on your screen.
Okay.
Did it come up yet?
No. I will, like to hand over to my co-chair, Simon, to take you through how today's meeting will work. So we welcome Simon to this forum. Welcome, Simon.
Yeah, thank you, Shada, and thank you everybody for joining us today. Obviously, it's very difficult sometimes to hold these meetings online, so we've got some sort of more organisational ground rules. One of the things is to protect us all, especially those who are wearing earphones or have headsets on, and for those who are triggered by sharp noises like myself, we keep everybody on mute, and that means that one, we don't talk over each other. Two, what we don't get then is sometimes we get feedback or outside noise. We once had a meeting where we had somebody drilling a hole all the way through what felt like the roof of their house. It wasn't, it was just feedback. So that was a learning curve. As Shada has said, come through the chair. So either myself, Shada, or Antonietta, as she runs it, we'll pick up any questions, anything. And one of the things we use is what's called a car park. So if somebody raises something that is possibly off topic, but might still be relevant, rather than say we're not going to discuss that today, what we'll do is we'll record it and we'll take contact details and somebody will be in touch afterwards and we'll have a longer conversation. And we've done that several times, and that's actually opened up into other wider work. And I've just seen Roger appear on my screen. Hello, Roger. And he's been in the car park, I think, once. And then we've spoken to him afterwards. So testament that it does work. So what you should be able to see is myself at the moment and the slide. if you're not that familiar with Teams, just to remind you, there is the chat function. What we would urge is if you've got any questions at any point, write them down. We have got a Q&A section after the kind of presentation. We are going to be using Mentimeter today to include you in trying to get some written feedback and thoughts on things. I just welcome Nancy. Hello, Nancy. Nice to see you today. But if you want to actually comment, you know, put your hand up, use the button there, and we will bring you in as soon as possible. Just because I mentioned it, we have got Mentimeter using today, and for those who haven't used Mentimeter, what it means is that if you've got, you know, if you're presumably most of you are on laptops today that I can see for definite, but you're on a device, that means you can either use the QR code there if you scan it with your phone, and it will take you directly to follow this presentation, but where it's more interactive. Don't panic too much about trying to get that now. My colleague Adib is going to put a link for those on a laptop and the QR code into the chat. Oh, he's just done it as if by magic. And if you can't get it, again, use the chat. What we want to do is try and capture your active kind of feedback and make sure that it's recorded, along with the recording of this meeting. So without further ado, because she's waited so patiently for many days now, I'm going to introduce our main speaker for today, who's going to introduce the subject of sexual and reproductive health strategy for 2023-2030, the lovely Antonietta Viola.
Thank you very much, Simon. Very, very pleased to be today. In terms of the consultation process, the first event for the sexual and reproductive health strategy for Birmingham City Council and Solihull Metropolitan Borough Council. So it is a joint strategy, and we are here to have your contributions, your involvement and your participation. So it's really, really important that we address what is a strategy that needs your co-production and your involvement in that. So today we're just going to go over an overview, look at the strategy itself in a very broad brush approach, and look at the consultation questionnaire, not in detail, but just so that you're aware of how we want your contributions measured, and in terms of qualitative, that means the numbers, and quantitative, or your feedback and comments that we need to address, and have that as part of that this consultation process. And also any questions that you have will be answered. So sexual and reproductive health is a fundamental part of our lives, and supporting a healthy approach is important at every age. But what's important is also that the strategy embodies the World Health Organization's recommendations, and we need to look at that across all citizens in Birmingham and Solihull. So just as an overview, the strategy recognises that there are areas of excellence, but there are also areas that still potentially need to be even better. So this strategy has achievable aspirations, but we also need to look at areas such as the prevention of unwanted pregnancies, and ensuring that all citizens of Birmingham and Solihull are provided with a timely information and advice service as well. But more importantly, as you all know, the pandemic has had a lot of impact and a lot of challenges, and we're looking at a recovery plan in regard to that, but also how we are working with people within Birmingham and Solihull and the citizens to achieve their potential for a healthy sexual and reproductive health, which is very, very important and paramount, as well as all other areas of health. So the strategy itself, it is a Birmingham and Solihull strategy, as I've mentioned many times now already, but more importantly, it has 5 themes and priorities and approaches to meet the sexual health needs of both population groups. And it sets out plans to respond to increasing rates of sexually transmitted infections, HIV, and improve the reproductive health of our citizens. And we know that sexual health impacts on all aspects of our lives, emotionally, physically, mentally, economically, and social relationships. And it also impacts on the other impact is also compounded by the social stigma and fear. And it's great to see so many people coming along today to participate and to start contributing to this consultation, because we want to reduce that stigma and fear and make sexual health services more accessible to more people. So the strategy and associated action plan is also affected by the wider determinants of health, as I've just mentioned. But more importantly, we need to work in participation with everybody to address the national, regional and local areas that are crucial. And more importantly than that, for me, it's the right actions for the right people in the right place at the right time, so that people are reducing their stress, reducing their impact on their lives. And with challenges around reductions in public funding, it's more vital that we are working collaboratively in terms of looking at the inequalities in health, not just in sexual health, but across all areas of health, but particularly today, sexual health, and more importantly, to provide accessible services to all. So the 5 themes are listed in depth and in detail in the strategy, but as a broad brushstroke, the first one is priority groups. Second is reducing the rates of sexually transmitted infections. Number 3, reduce the number of unwanted pregnancies. And 4, building resilience. That's a passion of mine in terms of public health, building resilience within people, and especially children and young people. So your first action and participation for today, do you agree with the 5 themes so far that we have? Can you kindly look at your Mentimeter and put your responses accordingly? Thank you.
Yep. So we've got, obviously we've got the one there. We've got 2. It's not a trick question. We genuinely want to know what you think, and we will have more in-depth time to kind of come back to this and go through those themes. But just in general, it's quite equal at the minute. So I'm going to leave that running for a little while. What we could do, I don't know if you're able to, Adib, or if you are, Antonietta, is to put them in the chat, because if I go back, we lose this slide. So I don't know if you know them off the top of your head, if you just want to kind of know that theme 1 with around priority groups. Do you know them off the top?
Lisa has her hand up.
Okay, Lisa.
Can you put the QR code again up, please?
Yeah.
I can't get into chat.
Okay, mate, no problem. Adib, are you able to send Lisa via email that QR code, please? If you can't get it through the chat, I can't put it up on this without going all the way back, Lisa. So we'll send you that. But if you've got a comment, put it in the chat at the minute. Oh, you can't. You haven't got chat. Sorry.
It's all right. Don't worry.
So at the minute we've had, we've had a few, and in general, it feels like, people are saying that seems like it's okay. I'm just going to look in the chat to see if we've got any comments there. So we've got Magdalena, unfortunately, has had to leave. But Roger's put okay. I'm presuming you're saying they're okay, Roger. I might be wrong. Jay Burton has put I agree. So we've got 6. So in general, that's going along there. What I will do, because I want to make sure that we have lots of time for the debate and discussion part. that will keep running. And so you can still vote, so don't worry. And we have got more Mentimeter coming, so you know, if you can't get on, don't worry too much about it. It's just giving us a bit of a flavour. So Cortha, I'm hoping I've pronounced that right. I really apologise if I haven't. So they agree. So brilliant. So I'm now going to move it on to your next slide, Antonietta, and put myself back on mute.
Lovely. Thank you so much for that, everybody, for the participation. And again, please contribute at any stage within this whole presentation today. Really appreciate your involvement. So the key enablers that runs through all the 5 themes is the innovation and technology. So we want to start introducing that and imparting that throughout the whole strategy. And also looking at the inequalities and vulnerability is importantly within the community and those targeted areas of all ages, and aims to improve the sexual health of the entire population, more importantly. So it doesn't, it's across the spectrum of all ages. So looking at the prevention area within the strategy, it's a major priority. And although this strategy focuses on a universal approach, there must be targeted interventions for certain groups, as I was just implying earlier, such as the under 25s, men who have sex with men, and minority ethnic groups who are disproportionately affected. So this strategy is supported and reflects the JSNA, a Joint Strategic Needs Assessment, but also the Sexual Health Needs Assessment that has been conducted. But more importantly, it is also starting to look at the integrated care systems that are going to be introduced this year, and looking at how across Birmingham and Solihull the integrated care systems are working we are working in parallel with them. And just a little bit more about the strategy in terms of that integration priorities, as I've just mentioned, but more importantly, that the strategy was developed by Birmingham and Solihull Council's public health departments and the commissioning teams as well. But more importantly than that, for me, is that involvement, participation and contribution of citizens, from people from the public sector, the providers, all the stakeholders, and also other views that people, you know, we want views of the strategy so that we have your input and have that incorporated within the strategy itself. And then the final version of the strategy we published after it's gone to the cabinet members, and then to the Health and Wellbeing Board in terms of the governance process within both councils. And here is the main area that we would love and like your contribution, is the consultation questionnaire. And there are accessible versions of both the strategy and consultation questionnaire. So if you need and require that, please feel free to email me. The details are going to be coming up in the next slide or two, where you can have access and how you have access to that. And our proposed approach is set out in the draft strategy and is intended to direct our actions in Birmingham and Solihull. So this consultation questionnaire is part of the consultation process, so that we've got your feedback, your contributions, and have your say within this strategy itself. So it is live today. It's on space, and we're the link will be put into the chat. If you don't have the chat, we'll email that to you. So the consultation questionnaire is open and live, and it closes in 6 weeks' time on the 5th of July this year. Are we able to have a look at this, the link at the moment, Simon, or that's a bit later? You're on mute at the moment.
The power of self-mute. There you go. Adib has literally just put that link in the chat. So hopefully,
Lovely.
you know, spend that time, because I think today what we want to do is concentrate on the conversation and trying to find those things. That was your kind of thing today, wasn't it, Antonietta? But
absolutely, but I just
it's there in the link, I mean in the chat, so please feel free to have a look, and I'll put myself back on mute and hand back to you.
Thank you very much for that, Simon. So the dates that are on your screen at the moment are highly important, because we want more participation. So if you know people would like to be involved a bit more, have their say a bit more, it's really important to distribute these dates. And I just didn't want to have a one-off event, because that's not going to really do the process justice and give people time to actually participate. And that's my passion, is in terms of getting people to participate in public service delivery and health service delivery. All dates and time, times are going to be, and venues will be confirmed very shortly. They've all booked, but I just wanted to make sure that we've got the dates out first, and then all details will follow after this meeting, consultation meeting. So another process to participate and be involved. Do you agree, another Mentimeter question, do you agree with the broad direction of the strategy so far? I know it is a very broad brush approach today. It's a very light touch, but we want to see and hear your contributions with that consultation questionnaire, and all the details are on there. Downloading the strategy is on that link, on the Be Heard link. So you've got everything at your fingertips.
Yeah, and I think it's right to say that what we've got is that broad brush today, and I think that's why we wanted to have that, because I think so. Hi Simon, I'm sorry, but I can't see anything. Is it possible to have the recording sent to me? That's Marvini. Yes, we will resend the recording out afterwards. So don't worry too much. As long as you can comment and you can speak, to be honest, if you can't necessarily see either me or Antonietta, you're probably having a slightly better day than the others who can actually see us, because both of us keep freezing at the moment. So we've got nine people saying yes, they agree, 4 saying not sure. Interestingly, most people haven't disagreed, and I think one of the things that you've mentioned there is that as the strategy goes forward, we want to have people's inclusion to help direct it, etc. So that's going to be a really important part of the work as it goes on. So I'm going to put on to the next question and ask if, and do you want to, are you there, Antonietta? You've kind of frozen.
Yes, I'm here. Yep.
Yeah, it's
so
just
the
that
next question, thank you, Simon. Yeah. Is there anything that you would like to have added to this strategy? Now, you can put those terms, words, a bit of feedback within that Mentimeter process. So these things might not come to you straight away. If it does, you think of something tomorrow, just email us to make sure that we've got your contribution with that. But more importantly, add that into the consultation questionnaire, because that's where we really want to measure and quantify and qualify the details for the strategy.
Yeah. So somebody just put there, how is mental health playing a role in this strategy? Really, really important point. it's those things that, you know, that aren't always obvious. I mean, we when we were doing a little bit of work a little while ago, we had somebody who spoke particularly about, you know, within the LGBTQ community around chemsex, and it wasn't part of the strategy originally. So it's thinking of those things that maybe, you know, I know you've not had the chance to read it fully, but what is important? What do you mean? What do you think needs to be in there? So we've got guarantee of consistency in services across Birmingham and Solihull, which is again a really important point. So again, if you haven't got the ability to write, oh, as he says that, more comes up. Is there a cultural awareness approach being incorporated? More diversity, less generalization of social groups. We've had Jay Burton in the chat, emotional and practical support for young people. Very good point in there as well. More training to people. I think this is Roger who put it, because I think he put that in the chat earlier on. Include the backcountry partnership too. I'm presuming that's an organisation, but that's really good. Going to see if there's anything more. I don't know if there's anything you want to comment on at the minute, Antonietta. I think there's some quite interesting.
I'd say more training to people. I'd like to know a little bit of, I understand the others, a little bit more detail about more training to people would be helpful. That would give us an idea of, you know, in which specific area related to sexual health are you referring to? Is it professionals? Is it citizens? Is it young people? What, you know, any specific age groups?
I mean, does the person, we don't want to put you on the spot, but the person who put more training to people, if you wanted to come on and just speak on that point, you can please feel free at the minute, because we're into that kind of, we want to begin to have a discussion now. There's a lot of comments in the chat as well. I don't know who put that. Anybody?
Yeah, this is me. I put it that.
Hi, hi.
Yes, hi.
Is it course there?
So it's best to give people for the age between maybe 10 to 16. People on this age, when we give them training or also some advice or just to carry and to be with the others. And to know how to help others, how to be together, how to develop our country. This is good. And they don't, on this age, we didn't leave them to be alone, and they go to outside on the street, something like that. Maybe they help.
Yeah.
Brilliant. Thank you for that. Did you want to come back on that, Antoinette?
Yes, in those areas, in terms of the under 25s, that's what we're looking at having the strategy address as well. So the children and young people theme, which highly focuses on that area. And I just saw, so we're not leaving any of those age groups out. Can you contact GPs and CCGs? And also I'll put pharmacy in there. Now is the right time, because we've started this consultation process, to then look at speaking with GPs, CCGs, and also the other providers of health services, sexual health services, and also their partners, and also pharmacy, so that we can become engaged with this consultation questionnaire, because a lot of work has been happening behind the scenes before today to get us to where we are at the moment. And so now it's a very timely for that to happen going forward.
Yeah, I'm just going to read out some more, just because we may have people who can't see the screen or have a visual impairment. So did somebody just speak then, or was that me hearing something? Sorry. So another very, very good point that's been raised before: the impact of abuse of all types around female genital mutilation. We've got another comment around support for victims of rape. Again, really, really important work to look at. A lot of stuff talking about better partnership working with the NHS and other third sector organisations. Health and wellbeing drop-in centres currently closed. 3, beware of excluding the older citizens through exclusionary, I can't say that word, exclusionary use of technology. Again, that's a really important point, that actually part of the support needs to be available to all. So yes, technology might be help, but actually one of the things that we do as an authority or try is to kind of channel shift people where you can use technology, where you don't need to speak to somebody, to self-serve, to help yourself, but thus hopefully freeing up other services where you might need that more time for one-to-one. I'm going to scroll down and I'll pick out some of the chat. Training for a frontline staff, trauma first disclosure, CSE, basic intro of how to assess sexual reproduction health to services, LGBTQ plus awareness. These are brilliant. We obviously teach sexual health in schools. So I'm not going to be able to pick them all out. I just want to pick some of those that are in the chat. So Roger's put has talked about the Black Country Partnership. So thank you for clarifying that, Roger. Brees has put one, liaison with the NHS to see what is possible, most needed. 2, health and wellbeing drop-in centres. I've now identified who put that comment, because it is they're currently closed. Donna's put support people with learning disabilities. Again, we've got somebody, Hina has put support victims of rape and sexual assault. Resources that are accessible via apps and pamphlets. How about with police, e.g. local area neighbourhood watch? Roger's put in there age concern help with older community. So that's going to keep running, because we have got another Mentimeter, and then we want to also talk with you. So I'm going to bring in the next Mentimeter, because that one is really about how can you get involved. Over to you, Antonietta, again.
Thank you very much, Simon. And yes, your participation is very, very much welcome. So how do you think you could get involved to help develop this strategy? What are the avenues? What could we be doing more of, less of? We just need to know your views on how you can get help to be involved with this, and what's more appropriate. Is it, we've got the in-person event on the 23rd of June. Is there anything else that you would like to have within the 6 weeks? Remember, there's a 6-week time limit. It can't go on for more than 6 weeks. Otherwise, we'd be going around the houses and not taking any action on the strategy. That's more important in terms of my public health background, is that action that we take from the strategy and implementation. So how are we implementing the strategy? It's not a document that just sits on the shelf. That's my my line always. But we want to get that strategy into action, into implementation, so that users, people, citizens can benefit from that.
Yeah. So I think it's really important. It's not an abstract question. We actually, you know, as Antoinette, as you said, we actually want to get you involved. And when this strategy, you know, hopefully goes through, you know, and is acted upon, there'll be, we again share my experiences. Somebody's put absolutely, and that is really important. It's learning from you. You know, we have you know, our own lived experiences. We have maybe, you know, academics, etc. We have professionals, but actually, what is the experience of somebody? You know, I'm thinking of, you know, that partnership working as well. So again, Roger putting in there the different organizations he's involved in, etc. would be really important. So it's thinking about not just this short 6 weeks, how do you want to be engaged with now? You know, so we are going to be emailing you all after this. We will also be we will also be emailing. We may be sending it by eel. It's eel post. I've heard of snail mail, but never eel post. So yes, we will be sending it out again. So how else might we want to share this information? I work at BSOL Mental Health Foundation Trust, and I believe that more dialogue between BCC and our trust would be a good starting point to discuss ways of collaboratively working together to support our communities. Great point. Could ask our service users what barriers they may have been accessing, they may have had, I think that's supposed to be, in accessing support services through very short user-friendly questionnaire. So we've got the, it's not necessarily very short, but it is a very friendly and open and inclusive questionnaire. So again, I would urge that, but definitely as we go forward, maybe I'm a behaviour consultant and would like to work with schools and families in their homes to raise awareness of good sexual health and good mental health combined. That's excellent. Yeah, definitely. I don't know if anybody's got any comments they want to add. So if you want to put your hand up and just come in, if you've put, we've got Shada's put, you know, working with the carers hub, and I think the carers is a really interesting part of this, because again, they may be supporting somebody who may need that help, may need that support. So actually involving carers in the strategy is going to be email or create charity to help community.
So this is also in regard to the strategy. So so those 5 themes that we did mention, how could you be involved within that in terms of putting your maybe experiences, etc. And if those comments, if you could kind of, you've put some bits, you know, some items down here. Can you add them into the consultation questionnaire so that we can capture all these valuable comments and feedback through this consultation, as well as through the actual questionnaire itself? So that will be very, very helpful.
So we've got case studies there. I just reposted the themes in the chat for those that can see it. And just to remind you, theme 1 is around the priority groups that Antonietta has already mentioned in there. Theme 2 is reducing the rate of sexually transmitted infections. Theme 3 is reduce the number of unwanted pregnancies. 4 is building that community resilience and individual resilience. And 5 is supporting and working with younger adults and children. So again, in there, if you've got something that you think you can offer to be part of, etc. So I've got respect my beliefs. That's an interesting one. I work in a school and the school nurse is so valuable. What about contacting them? That's a really good point. So yeah, I've got Eleanor in the chat. I run Loudmouth Education and Training, and we work alongside Umbrella to help schools and colleges with their relationships and sexual health education through theatre and in education. Wow, that's amazing, Eleanor. That's a great offer. Oh, you've also wrote it on a thing. Literally, as I'm reading it in one, it pops up on the other. Very much keeping me on my thing today.
Simon, I'm adding them.
Oh, are you? You're a legend. Do FGDs. FGDs. Whoever's put that. Do you know what FGDs are? Off the top of my head, I don't recognise the acronym. Antonietta.
No, whoever. Can you put that in the chat? FGDs.
Yeah. But do FGDs and develop a research paper in partnership with UHB. Focus group discussions. Thank you. I thought it's because we've got so many other acronyms. I was thinking I've not heard that one in relation to this, but now you've just put focus. Thank you, Andrea. That absolutely makes sense. Yeah, and part of this work going on, we will want to have yes, we all do love our acronyms. Sometimes it's very there. Cultural sensitivity and delivering awareness. Absolutely, Shada. Really important part of what we're doing. I'm going to move this on to the next part.
Can I just say something quickly,
yes,
Simon, before we move on?
Yeah.
So thank you. I was going to put my hand up on virtual, but I thought I'd just pop in just before, and I'll probably say it again. So the people that are here at this initial consultation, and I know Eleanor, you work and run Loudmouth Education and Training. Could you kindly disseminate the link for the consultation questionnaire to the people that are using the services, because we want to have their input as well. So people who are providers of the service, users of the service, citizens within Birmingham and Solihull. So it is, again, you're the first catalysts to disseminate and to bring this strategy to life, and so that it has meaning and has contributions within future actions within Birmingham and Solihull. So thank you in advance for that.
Yeah. So we've got Eleanor has already said yes. So there you go. So yes, will do.
Thank you so
Brilliant.
much.
We've got M Johnson has just put up there. I'm a local writer and advocate for social projects and services, local forums and support groups where education and more education is the goal, focus groups and meeting groups and forums. So again, that's a great, so if you've got that ability to cascade and push this out, that would be fantastic. But also, most importantly, get involved. Afeni Kettle has put, I work for Beth. Really sorry, guys. I should have put my teeth in before we started. I work for a Bethel Health and Healing Network with vulnerable women and their children, and would love to have someone who could meet with them to discuss around sexuality. That sounds like an offer, one that I'm sure that we will definitely want to take up. So yes, I think is the answer to that, and we can help facilitate that outside of this meeting. So that's great. Contact. Oh, so a really good point actually. Shardra just put the neighbourhood network services to cascade this and the strategy out through the neighbourhood network services. And for those who don't know the neighbourhood network services, they are again something that the council is trying. We used to be very much part of working within the communities of Birmingham and wider, and over a long period of time we kind of centralised everything. Actually, the big drive now is to put ourselves back in the community, but not how we were before, as part of a partnership with you to empower communities to work together. So that's called our neighbourhood network scheme. So you can look that up. We can always send that out afterwards, but absolutely, that's another great channel. I am going to move it on to the next bit now, not because I don't want people to keep writing or anything, but because it can be more interactive again. So if you've got any questions or anything you want to ask, you can either put them in the chat and I will do my level best to read them out accurately to Antonietta. But other than that, we'd like to hear some of your voices, what you think.
Yeah.
So if you want to put your hand up, I will call you in some sort of order. We have our first hand up, which then suddenly went back down. So I don't know who that was. So if you want to ask, there we go. Afeni, would you like to come in and ask a question or make a comment or just start as in a discussion? Please fire away.
Yeah, yes, thank you. Yes, thank you. I just want to highlight what I've said earlier on regarding working with Bethel Health and Healing Network. It's a group of vulnerable ladies who I work with their children, and I try to meet their needs within the community and their homes. And I know you said that it would be good to facilitate it, but because they're vulnerable ladies, it's difficult to work with men. So
yes,
we look basically looking around for women who can work with them to discuss things and how they can live their life free, and also reduce the risk of sexual transmitted disease and things like that, and also look at pregnancy within the, for instance, looking at what they can do to prevent getting unwanted pregnancy. But because these are Black women as well, most of them are Black women, and I work with other nationality, but I want to specifically aim around Black women as well, to look at how they coping because they believe that there's no one listening to them. And it's hard when you're trying to say we are working with you and we're trying to work with you, but it's also having an understanding that they are heard and they are listened to, and we will value who they are.
Right. Antonietta.
I think this is really important in terms of those targeted groups and those vulnerable groups and reducing the inequalities. And they're not just words, they're really important in terms of how the strategy then becomes a living and working document in terms of the service specifications that we look at addressing in terms of who provides those services. So these are the important points that need to then be put into documents where providers then need and have to deliver on certain vulnerable population groups. So, and if you're not being, if your people that you're working with aren't being addressed within the current system, we can help you get support from the current providers within Birmingham or Solihull.
Brilliant. And obviously,
Thank you.
Yeah, no, thank you very much for sharing that. And obviously, one of the things, we're going to share our email at the end as well. So when we email this out, if you want to, then you can kind of build upon what some of the barriers may be. And when I say I'll facilitate, that doesn't mean I will turn up. What it means is I'll help to get you to speak with the right people at the right time, etc. Within those difficult and with those issues that you've just raised. So, you know, absolutely. And again, the same with whoever wrote the other thing. You know, we will facilitate you to speak to the right people at the right time. I've got Cortha, her hand up. So do you want to come back in?
Yeah, hello.
Hi.
Okay, also we need to open we do one charity, and the charity is work with Arabic tuition, and we help refugees people. And on this because we needed to help our communities to know the other language or other people when they need to learning Arabic or something like that, we can help them. We are group and more 5 people with me, they has PhD. And I called them, I spoke with them, and I say, yes, they are interesting to help people. And also we need to put it refugees to help refugees to know the law in this country, and to support them to get them on the right way. That is what we need to do. But really we found it difficult to find place to do this our jobs.
It's a really, really interesting point, Antonietta.
Yeah, I think as just mentioned, what's really important again is those that, like I've just said to the previous lady, we want your contributions and involvement. So that the health questionnaire, consultation is a health questionnaire, consultation questionnaire for the sexual health and reproductive strategy. We'd love and like you to put all your comments in that so that we then can act on those elements that you highlight. And again, if you need signposting, or if it needs to, as Simon said, cascading to other service providers, to service providers, then we can do that for you as well. So really importantly, if we can get, I know I'm harping on about it, consultation questionnaire is our priority to have that completed. And then the other thing is we've got the in-person event, and that's not me being online and you being in Birmingham. I do travel. I will be in Birmingham for that event on the 23rd. So then come and talk to us face to face. And I know that hasn't been, you know, what we're accustomed to online at the minute. So let's do more face to face. We've got that planned for the 23rd of June, and most, you know, we just need to know if you're attending and confirmations of that. So yes, looking forward to speaking with you about this in person as well.
Yeah. So and I think what Courtney just raised there is a really important point. You know, we are part of the strategy is dealing with people who are fleeing, you know, not just internally within the UK, you know, that may have had sexual violence, etc., but also externally, because the people are coming and settling in Birmingham. So it's a really, really important point. So again, really urge you to get in contact outside of the meeting. And again, we can help to facilitate, and also understanding though, you know, the barriers of communication. That's really, really important. So thank you for that point.
I was just going to say something. Can I add to that, Simon? Sorry.
Yes, please go on, mate.
I think what Kothar was talking about was a place where they can, you know, help people. I mean, there might be places where you can get basically hire, or then there might be free places like sheltered accommodation. They've got common rooms. I'm sure there's a lot of other places where in the NHS, etc., that might be interested, because it's the less visible communities, such as the communities that you work with, that are invisible to the local authority and the NHS. So if you guys can have a place, at least we know where we can find you, so we can be in touch with communities that you work with. Thank you.
Health Watch.
Thank you.
Neighborhood Health Watch.
Yeah, great. So I've got Colin. So Colin, you've got your 5 themes. Will the strategy include info on how progress and success against each of these themes is measured and published? No point in having themes if we don't show we are actually addressing and improving over the life of the strategy. That's a great question. Thank you for that, Colin. Antonietta.
Yes, and more importantly, can we add that into the consultation questionnaire? That will be very timely, and we do need measurable key performance indicators. We need outcome measures. We need all that public health data, and that would be part and parcel of how we then do our contract monitoring, look at how the services are delivered, where and when they are delivered. So again, those themes then are the themes are the overarching elements, and we then have those KPIs, outcome measures, so that it is measured, and then the qualitative and quantitative elements. So it's just not, it's the subjective stuff, the things that your feedback provides that we need more information on. So it's not just the numbers. So again, I'm going to harp on it. Consultation questionnaire, kindly add your input there, please. Very valuable. Thank you.
Yeah. Brilliant. And I think one of the things I will say as a team, the citizen involvement team, is that what we know for definite is that your involvement as this goes forward, and I don't just mean through, you know, the consultation that we're having today, but actually in designing and delivering the services, you know, if this goes through cabinet and is passed, you know, Antonietta and everybody we will want you involved in developing. So in many ways, you can be part of and understanding those measures and making sure they are delivered on, Colin. So I think, you know, it's not an abstract that we would just feed the information. Working in partnership, working together means that you will see it live changing. So we've got sorry, it just changes so very quickly. Shadi, you've got your hand up, and that gives me a chance to capture some of the questions. Go for it.
Thank you, Simon. I was just thinking, you know, this neighborhood watch are connected with housing association and with the police and local residents. And we are having a meeting on 27th. Why don't you come and talk to them? And Abid was saying that we need to look for a room and space and everything. If something is happening, go along and talk to them. You might meet local neighbors, community people, and bring your forms, consultation. And it can be a local outdoor activities. So think about that, Simon and Antonietta.
Yep.
Thank you.
Brilliant. Thank you. Yeah. So I'm just going to go. So yes, Cortha, we will send you all the details of the further engagement sessions. And what again, we would urge is that if you have come here and you go away and read the strategy and then want to come back and ask further questions, attend those meetings. So absolutely. So thank you for that. Julie has to leave, but thank you very much, Julie. She's got to go on to duty. We have Graham has the provision of PrEP for gay men and chlamydia screening young men being taken into account since the change in focus of the National Chlamydia Screening Programme. So really great question, Antonietta.
Good question, Graham. Thank you very much. We've just done a contract variation for Birmingham and Solihull, so we've addressed that within that contract variation. So it's not really to going into detail on a consultation forum for the sexual health strategy, but more than happy to pick that up after the meeting.
Yeah, that's a good idea. Yeah. So again, if you want to put your contact details, Graham, well, we have got them, but you know, we can pick that up outside of. So that's great. Andrew has put, is there an appetite for creating a forum of discussion between BCC and the NHS Trust targeting discussion around sexual health? Great question, Andrea. Thank you for that. Antonietta.
Lovely. I should have a panel here, shouldn't I? So that could go to another panel member.
Yeah.
However, it's just me today. There might be other panel members next time. We'll just see. But I'm more than happy and capable to answer the questions. Answering that question very specifically, that's what we're moving into, integrated care services. So the ICSs and the area between the footprint area, we could call it a footprint area, across Birmingham and Solihull, is that integrated care system. And my background is in integrated care prior to being here in the UK. So that's where now the focus and let's say understanding of health services and not duplicating health services or siloing of health services. And across the local authority, across health sectors, CCGs, and those partitions of different providers in terms of what CCG provides, what the local authority provides, all those, I'll say, fragmented approaches. We need to be more integrated. We need to have an overarching process. But more importantly, the duplication, if and when that happens, we need to look at that model becoming, I'll call it the people-centered areas, so that they're the hub of the service. And that's where my background is in that the person is the hub of the service, and then how are we integrating the elements of health that they need around the person.
Brilliant.
And not just again, sorry, and not just again making it lip service. It's the government have now understood that that's the best way of using financial resources within the climate that we've just experienced. And how are we going to use the financial resources more effectively is in that integration model.
Brilliant. Thank you. Does that answer your question, Andrea? I can see you nodding on the screen. Thank you. Great. So and we've got a clap. We've got our first clap. That's great.
Thank you. Thank you.
So we've got so I don't think my question of PrEP was answered. Oh, sorry, I was just reading out your thing there. So I don't think my question of PrEP was answered. Will funding be continued and increased according to demand? That's Graham again.
Yeah, that again is something we're going to be looking at, and I don't think it's the area to discuss this type of question. I'm more than happy to answer the question offline, because this forum is about the strategy for the sexual health strategy. Anything around PrEP and the funding elements can be answered separately.
Yeah. Great. So we'll do that. We'll set something up for you with Graham so we can have a chat. And thank you for that question again. We've got, and Graham's representing the charity Positive West Midlands HIV support group. So thank you for that. Sarah has asked, issues and experience in sexual health present huge demands for specialist counselling services, consideration as to how this can be fully met. So that's a question about, you know, obviously counselling and meeting that need. Antonietta?
Which one are you? I have to read it. Sorry, which one was that one? Sarah's?
I'll read it again. So that
please.
Yeah. So issues and experiences in sexual health present huge demand for specialist counselling services. So essentially the question is there consideration as to how this counselling can be fully met? I'm presuming that's what you mean there, Sarah. You're more than welcome to come in and correct me or ask the question directly. But that's what I think it is. Can we in strategy, does it consider the specialist counselling services?
Now, this is a great opportunity to include that within the consultation questionnaire. So that's where this great information is going to be captured and utilised. So please don't think it's, again, that lip service token strategy consultation approach. Please add those elements in so that it can be considered within the delivered services in the future and the service specifications within the future. So that's what we need your input in. And again, if you want to have a direct contact with us on the 23rd face-to-face or at the other meetings on the 16th and the I can't remember the last, it might be the 30th of June off the top of my head, please speak with us about that. And that's both Simon and myself at the moment. Yep.
So the dates again, so I think it would be really good because to go away, because it's become live today and literally you are the first people that we've spoken to. So have a look at that strategy, and then so we will put the dates again, we will send them out, but that gives you a chance to come back again on the 16th and talk about what may be missing, but most importantly we'll record all of these points. I will come to some more questions there. So I've taken off the presentation so we can see each other better if we are speaking. Jay Burton has to leave, but thank you. Thank you for coming. Shadi, you've mentioned time. I'm presuming you think we may be finishing at 3. This meeting is now finishing at 3:30. So we've got an hour and a half because it's we want to have as much time for debate and discussion. Colin, you mentioned resources or resource. Oh, it says somebody post something, it pops. Right, I'll try and hold this steady. You mentioned resource. How sure are we that we will have the necessary resource to deliver all the sexual health needs? We don't want to overpromise or underdeliver. Really, really great point. Thank you. Antonietta.
And that again is part of the consultation process, and I know I'm mentioning that again, and then also part of the delivery, and that's worked with public health and commissioning colleagues within the council for both Birmingham and Solihull, so that the expertise is evidenced as well, looking at what other local authorities have done, what does excellence look like within the sexual health delivery models, and also looking at what the needs are, and that's what the needs assessment is about, and what public health is about. Excuse me, is about what are the needs of the population and how are we going to meet those needs. So the more we consult with people, citizens, and providers, the more we understand where the needs are. And if there needs to be targeted approaches within certain areas within the population group.
Does that answer your question, Colin? I can see it looks like yep, we've got a yes.
Thank
Brilliant.
you. I just had a little bug in my throat then.
Yeah, no, don't worry. So I don't know if everybody else has got any questions or want to come in with any comments. I thought I saw Nancy typing furiously for a moment.
Please note, this is cordial.
Thank you.
This is cordial, okay?
Yeah. Did you want to come in, Nancy? I could, or it's just because I saw you kind of waving-ish. Don't worry. Yep, you're still on mute. Nancy, you're still on mute. Nancy, we can't hear you, unfortunately. You're on mute. Collins put parties are not allowed. Very good. I'm glad you put that. It's true. Yeah, Nancy, do you want to try again? See if you can get yourself off mute. I don't want to put pressure on you, Nancy.
Okay.
There you go.
Can you
Yeah,
hear me now?
you're there. Great. Go for it, Nancy. Ask your
Yeah,
question.
okay.
or your
Hi,
comment.
everyone. I'm just
Good to see
thinking because I have worked in education over last 15 years, and I'm just thinking whether is government thinking to offer the training to the student from in the school, so when they are in the young age, so and then they will have the awareness of healthy sexual knowledge, and then when they grew up, so they knew how to be responsible parents or father or mother. I don't know whether it's government thinking to offer this training to the students.
Antonietta.
Yeah, these areas of high need, and I've just seen Donna Daly's comment about the learning disabilities and support there. There are and should be avenues within the current provision to have sexual and reproductive education as part of what you're doing within the schools. And it might be selected schools, but if you need specific assistance with that, then I can direct you to the right and appropriate persons within our current provision of sexual health within Birmingham and Solihull to obtain that for your students and for the learning disabilities. But there should be already also school nurses that could also potentially provide that those lessons, and also other professionals that can come into your school or department in terms of learning disabilities. And there's also the children and young people service within within the local authority that could also assist with that.
Okay,
Brilliant.
thank you.
I've got thank you for that, Nancy, and thanks for finally being able to get off of mute. I know it's not always easy. Actually, I'm going to bring in Eleanor because I was just about to read your comment, but then your hand came up, so please come in, Eleanor.
Just a quickie to answer what Nancy was saying as well is I work with Loudmouth, and we're part of the umbrella sexual health services, and we work in mainstream and non-mainstream schools with a range of pupils with a range of abilities and needs to support schools and their pupils in having healthy and happy relationships, and sexual health is part of that. And I know Umbrella's doing a lot of work around SEN young people as well, so and we can help to a certain amount with that as well. So I think there is work going on. It's finding out about it, and Umbrella may be a good starting point, if that's any help.
Thank you.
Yes, and that's
great.
Yeah,
thank you.
and that's what I was implying.
Yeah, thank you.
Brilliant, thank you. So Graham's just put will the umbrella partnership in Birmingham LGBT hang on, I can't read it all. There you go. Will the umbrella partnership with Birmingham LGBT be reevaluated? Has it been successful? I think that's probably a question for outside of this meeting because we have no say on umbrella, but what it does show is there is work going on already, and what this strategy is trying to do is combine it. So answering Andrea's question earlier on, trying to combine a lot of that work to make sure that people are getting what they need, where they need it, in the way they need it, and it isn't just the council. So when people have talked about, having that community side of it, where it's culturally sensitive, again, that's a really important part of it. So I don't know if you want to add anything to that, Andrea. I mean, sorry, not you, Andrea, Antonietta. There's too many A's on the call. So and then I'll bring in Donna.
I know.
Go on.
And again, I think this is, again, what you just said, Simon, a question for outside this consultation. We are looking at the strategy at the moment, and not to discuss anything that is sensitive, like Birmingham LGBT and evaluations and if they're successful or not. I think that needs to be spoken in regard to an organisation, and understanding that. Are you from Wolverhampton, Graham, the Royal Wolverhampton NHS Trust? Yeah. And we just need to speak face to face in regard to that at the what's it called, the in person consultation. But again, that's a question outside of even that day, but can direct you to anybody who can answer that for you at a later date.
So Graham is part of Positive West Midlands charity group. So,
okay.
But what we'll do is we'll again drop us an email. When we send it to you, and Eleanor just put info for loudmouth.co.uk in the chat. So I'm going to bring in Donna though, because Donna's not spoken. I know you've dropped in and out a few times with your iPhone, Donna. So please come in.
Yeah, I was just wondering, and I've sort of put a question about LD but in general, there's a lot of groups, and I don't want to list, but a lot of groups that in general are not considered to be sexual. By now, invariably people are, even if they're not considered to be, and I just worry about or wonder about what's being done to help people or support people, I should say, who society in general don't view as being sexual, and so perhaps don't actually, I don't know if that support is out there for groups like that.
Yeah, it's a great question. Thank you for that, Donna. Antonietta.
I think in what Eleanor has just mentioned, those groups that are part of the umbrella group are more than qualified to assist in these, I'll say, marginalised communities maybe, or areas that aren't discussed in terms of sexual health. So I think again, this is where it's a broad brush approach in terms of their first consultation. I didn't want it to be only one. So I know that there'll be more discussions, and if we can assist in directing you to where you can obtain more services, sexual health services, then we're more than happy to assist with that. So I think this is the first of 4 discussions that we can have that can build on each one, rather than, okay, this is siloed and then the next one's a silo. Let's build on each one, so that by the end of the 6-week consultation, you're more than happy with answers that you need, so questions that you need answered, maybe questions you need answered, and some areas that you feel there are gaps within the service delivery. What could we be doing more? What could we be doing less? What are the areas that we're needing some more assistance? So all those pieces of the puzzle are what we're reaching out for. And again, I'm going to mention it again. I don't know how many times. Can we count? Maybe
it's 22.
The consultation. The
22.
consultation questionnaire. Consultation questionnaire. Just add another one. So complete that for us, because that's as I am Australian. I have been here for quite a number of years, but that's the meat between the sandwich, as we would say in Australia. So we need to have that input, your contribution, because the strategy isn't. I'm going to say the strategy needs your input. That's my strap line for today.
Yeah. And obviously the what you're talking about there around unconscious bias, etc., Donna, which we've spoken about a lot in different things, is definitely in there. So I would urge everybody after this not only to go on to the thing, but and fill in the questionnaire, but you can go and read the strategy. It's gone live today. So and then hopefully that. So I'm going to bring in Shada as the last person to ask, then bring back Antonietta. And then I'm going to bring Shada back to end the meeting. So ask your question, make your comment, Shada.
Thank you, Simon. Internet, I would, you could include me. There's a project called Include Me Manager.
Yes.
Don't forget them. They are very, very well organized.
Yeah.
Anything happens, they are on the board. I'm one of the panel member of that also. Yeah. And you could also include university students. They have a department, and I'm a part of the health and equality. So I'll be happy to organize a focus group for you, or to
that
get
would
in
be
touch.
Lovely.
Brilliant.
Perfect, Shada. Thank you so much. Yeah.
Yeah, and this health, what is it called? Neighborhood Watch is happening next week. So I'll send details to Simon, and he will forward it to you. Just come, because our local, what is it called? Neighborhood Watch are wanting to do some activities. So why not do something which is real? And there are a lot of young people, we don't know if they're in drugs or whatever they are doing. They'll be even happy to talk to you. We don't know how many neighbors are going to come. Thank you.
Thank you. And finally, I get to see Graham at the end there. Hi, Graham. You disappeared on my screen. So, yeah, so I'm going to hand back to you now to kind of wrap up this little part here and what we're going to do next. So back to you, Antoinette, and I will spotlight you so that everyone can see you before you go. There you go.
I didn't have hair and makeup come in. They didn't show up this morning, hair and makeup. So I'll make sure I have hair and makeup for my next one, okay? But thank you for doing the spotlight, much appreciated. And thank you very much, everybody, for participating in today, because this is, again, the first of 4 consultation events that are really important to have your input, involvement, participation, to build the strategy so that it has more impact on the ground with citizens and providers, and also people that use the services. So really appreciate your time today, your contribution, and looking forward to meeting you face to face on the 23rd. And also in the other 2 events that are online. So thank you so much for your time today.
Brilliant. Thank you. Shada. Thank you, Antoinetta. That was great. Shada, over to you.
Okay. Thank you, everybody. How did you find today's forum? Pop your comments in the chat box. Date for the next meeting is Tuesday, the 14th of June, 2022, 2 till 3 p.m. We will email the presentation slides and the links to the online survey later on today. Any further questions, please email getinvolved@birmingham.gov.uk. Thank you very much and goodbye.
Yep. Thank you all. We've got some lovely comments in the chat. So thank you all very much from me as the co-chair as well. Enjoy the rest. Oh, yep.
And thank you very much, Simon and Shada, for assisting today. Very much appreciated.
Thank you, Annette, for your lovely presentation.
Yep. Yeah,
we've got very welcome. Thank you.
Really positive comments. Thank you, everybody. Thank you. Okay. Go and enjoy the sunshine. Thank you all very much.
Thank you so much.
Okay, bye-bye.
Take care and have a great day.
Thank you. Bye-bye.
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 Bye.
Bye-bye.